Well, there are calls for COVID vaccinations to be made mandatory for workers in the disability sector to help protect some of Australia's most vulnerable from the virus. Joining us live is Karen Stace, the New South Wales State Manager at National Disability Services. Appreciate your time. Before we get to the workforce, what does the latest data actually tell us about the vaccination rate for people with disabilities? How is the rollout going broadly in that sector?
Yeah, so what we know is that around 42% of people who are living in accommodation settings who are National Disability Insurance Scheme participants have had at least one vaccination, one dose of the vaccination. And around just under a quarter of other NDIS participants across all settings have received one dose of the vaccination.
We have been following the rollout here on Sky News, and in recent weeks providers have been complaining that they were being forced to really source their own vaccinations, that the vaccination teams they were expecting to come into disability care homes, for example, hadn't arrived. Is that situation improving now?
Look, what we hear from providers and from our members is that the situation is improving. There is a bit of a mixed experience, however, though, and like everyone in the community, we would really like to see vaccination rates increase, and we would like to ensure that it's easy for people with disability and for workers to access a vaccine.
Were you surprised to hear the government's decision to make vaccinations mandatory for aged care workers didn't actually wrap in workers in the disability sector as well?
Look, we were really pleased to see the announcement for residential aged care workers and think that that's an incredibly positive step to protect some really vulnerable people. We would really call and are urging the government to extend that to the disability sector. Some of the people that we support in our sector are really medically vulnerable, and the consequences of the virus for them and their families could be devastating.
Could there be consequences, though, in terms of the workforce? Are you worried that workers could leave the sector if the jab was mandatory? Can we afford to risk that? Do we have enough workers to take that risk?
Yeah, so whilst we really can't afford to lose any workers from the sector, and certainly some research has indicated that about 20% of people might leave the sector if vaccines are mandated, we think that there's a real balance between weighing up workforce shortages, but also, protecting some of the most vulnerable people that we support. We're also really confident that with the right campaign, with really good information that addresses some of the concerns that our workforce have around vaccination, that we can minimise the number of people who would be leaving the sector if vaccines are mandated.
And when you talk about mandating vaccines, can individual providers make that call for their own workforce, or does that really have to come from the federal government?
Look, the best advice we have is that it probably does need to come from the government, and that certainly makes it a lot easier for organisations to require their workforce to be mandated. So we would really strongly urge, very similar to as they've done in aged care, very strongly urge the government to make this really clear and really easy for disability providers to, protect both the people that they support, but also their workforce as well, and the community, of course.